So, Vesileia Digidiki is a fellow at the FXB Center for Health and Human Rights in the Harvard T.H. Chan School of Public Health. She holds a PhD in clinical and social psychology and holds a master's degree in forensic psychology and a master's degree in social psychology. Vesileia has worked extensively on sex trafficking in Greece, focusing on victim and client blaming and its impact on re-victimization and attitudes towards the phenomenon. Currently, her research focuses on the refugee crisis and the child protection challenges in Greece. Her background in psychology and her cultural connection with the island of Lesvos have provided Vesileia a unique opportunity to observe the crisis from its onset and to monitor the changing risks and challenges refugees face as the crisis evolves. Vesileia has also worked with vulnerable Roma and refugee populations, providing psychological support to children and families undergoing desegregation programs in Europe. Her work can be found in international journals and in the Journal of Human Trafficking. Please join me in welcoming.
Thank you so much, Lara, for this opportunity to discuss the Syrian refugee crisis in a different context and through different perspectives. And thank you all for being here today. Today we will shift our research focus from the Syrian refugee crisis in Lebanon, Jordan, and Syria to Greece, and specifically to the small island of Lesvos that became the ground zero of the Syrian refugee crisis in the country. The FXB Center, as a center with a special interest on child protection, was alarmed by the exodus of such a large number of minors within a small period of time and through a country that was not prepared to face that scale of a crisis, posing extra risk to these vulnerable children on the move. Our research employed the case study methodology in order to assess the situation on the ground and identify child protection challenges, risks, and failures, as well as good practices. For the needs of the research, 40 interviews were conducted with stakeholders, locals, and governmental actors, and the naturalistic and participant observation method was also employed. But before I present the results of the research, I would like to share with you some very important geographical and socio-political information regarding the Eastern Mediterranean route of migration that will help you understand better the barriers that hurt the child protection system. As you can see from the map, Greece, due to its unique strategic geographic position, is the frontline European country receiving the majority of refugees arriving from Turkey following the Eastern Mediterranean route of migration. The main entry points are the islands of the Eastern Aegean Sea, and especially those islands who are closer to the shores of Minor Asia and offer easy access to boats. From those islands, the island of Lesvos has received the bulk of refugees. The closest point between Lesvos and the Turkish shores measures approximately 8 miles, a distance that can easily be covered within 2 to 3 hours under good weather conditions. As you understand, this is a much safer and shorter route in comparison to the central Mediterranean route of migration, where people have to travel for days in order to reach Italy from Libya. Even though the first signs of the refugee crisis started in 2011, however, in Greece, the refugee crisis became visible in early 2015. And this escalation that caused Greece, Balkans, and the whole Europe totally unprepared can be attributed to a confluence of intersecting push and pull factors. Some of them have been simmering for years, but others are completely new. Looking at these figures, by March 2016, more than 600,000 people arrived to the small island of Lesvos, an island of 86,000 people. During the period that we discuss now, to Greece, more than 1 million people arrived. That amounts to 10% of the whole population. Just to give you an idea of what this looks like, in August alone, 2015, more than 2,000 people arrived daily. While in October, despite the very bad weather conditions, the arrivals exceeded times 4,000. And this photo here illustrates exactly what we experienced while we were in Lesvos. You could see more than 10 or 15 boats arriving at the same time at the same shores. During the period that we discuss now, refugees tended to travel from Lesvos to Athens and then walk towards the northern borders of Greece in order to cross to Fyrom and then walk towards the Central European countries. With these unseen volumes of new arrivals, even the best prepared European countries reached a breaking point in their ability to meet European Union standards in processing asylum seekers. Unfortunately, those countries with less experience managing and processing asylum seekers very quickly given in to counterproductive impulses. And we talk about months of tense negotiation over efforts to relocate people from Greece and Italy to other European countries, while in the process, transit countries such as Hungary, Croatia, Fyrom, facing enormous pressures to the borders, decided to seal their borders. In late March, due to an overnight shift in European migration policies that changed Europe from a corridor, Greece from a corridor to Europe into a country with sealed borders, more than 65,000 refugees, 40% of whom are minors, are stranded now in the country seeking for safety in impromptu emergency reception camps and open parks. This migration policy, known as the EU-Turkey Agreement, managed to significantly reduce the influx, but do not stop it. As you can see from the numbers, of course, we don't talk about the same number of arrivals, but we still talk about a significant number of arrivals that had an impact on the services provided to the already existing refugee population. Given the current conditions, our research took place in May 2016, a month after the implementation of the EU-Turkey Agreement, and we focused specifically on Lesvos, as Lesvos is the main entry point. In this slide, you can see all the risks that minors face while in Lesvos and in Greece in general. But before I start analyzing them in depth, I would like to explain to you why these risks have such a severe impact on health, but mostly on the psychology of these refugees. Of course, we know that refugees face adverse pre-migration events that have traumatized them deeply, in addition to the events that they have to face while traveling from Syria to Greece. However, the majority of them, when they arrive to Lesvos, they are strong and they smile because they believe that when they reach European ground, when they reach Yunan, they're going to be safe and they're going to have a second chance for a better life. Instead, they face a series of new challenges and new risks. And let's start with the first risk, which is the deadliest of all, and we talk about the crossing of the Aegean Sea. And just to remind you here that this is the first time that refugees have to cross the sea during their migration journey. In most cases, minors and adults in this case are forced to board rubber boats with other 50 people, despite the fact that the maximum capacity is 20 people, under very chaotic circumstances that causes many times the separation of children from the parents. These overloaded boats sit so low in the sea that they take on water, increasing the risk of a shipwreck. And this risk is also increased by the fact that most times the engines of the boats are broken or they do not have enough fuel, for increasing the risk of death and making the trip almost impossible. Moreover, during the winter, smugglers tend to send overloaded boats despite the very bad weather conditions, luring the refugees to travel by offering very cheap tickets to those people who are not able to afford the trip. And those refugees who are not able to afford a trip with less risks are not able also to afford to buy the very expensive life jackets. So we have seen many times parents arriving wearing life jackets, but minors do not wear life jackets because parents think that during the time of distress, they will be able to save their children. But of course, the risk of death is increased now in this case. And in this photo, you can see that sometimes parents trying to improvise, but again, the risk is there. Just to summarize here the risks, we talk about minors that have never seen the sea before in their life, being forced to travel in defective, overloaded boat under very bad weather conditions without an experienced navigator and without a life jacket, facing every single moment the risk of death. And you can understand now how this experience can impact their already fragile mental health, and I hope that Alexander will cover this later. When all refugees, adults and minors, arrive to Lesvos, they are taken to an EU-run reception center, the so-called hotspot, which is responsible for the identification and fingerprint of all refugees. Unfortunately, after the EU-Turkey agreement, this hotspot is turned now into a detention center, where all refugees have to stay there until their asylum process is completed, and their status as a refugee or a legal immigrant is defined. And this is where the second risk comes, and we talk about the perilous living conditions inside the camps. This detention center that we talk about is the main camp on the island, and it is an old army camp surrounded by a thick concrete wall and wire fence with a capacity of 3,000 people, however 6,000 people are detained there. The housing provided is not enough to cover the needs of so many people inside the camp, so many families were forced to stay inside tents in the open space without any privacy or protection. The number of sanitation facilities is not able to cover the needs of such a large number of population, while the location of the sanitation facilities does not guarantee any protection from gender-based violence. Regarding nutrition, the situation is slightly better in comparison to the beginning of the crisis, as now the Greek army is responsible to deliver 3 meals per day to every person inside the camp. However, it is unclear if the food distributed can meet the individual nutritional needs of everyone. Because unfortunately, the same quantity and quality of food that an elderly person or an adult person receives is the same as the one that a minor or a teenager receives also. Moreover, access to medical and psychological care is limited, again because we are not able to provide care to all these people inside the camps. Severe cases are referred to the local hospital, where the provision of medical care is free. However, this hospital is the only hospital on the island. So the hospital should provide medical care to the local population in addition to the refugee population. So there they face different challenges and different risks. Unfortunately, I'm not able to discuss in depth all the risks that stem from the perilous living conditions inside the camp, as time is not my friend today, but also because I would like to discuss with you the risks that stem from the gaps of the child protection system and risks that are deteriorated after the EU-Turkey agreement. The first gap of the system that marked the beginning of a series of risks that minors face in Greece is the inability to identify and properly register unaccompanied minors. The established process for age assessment of unaccompanied minors was never designed to crisis-level volumes. So during the increased influx, it was forced to rely on personal testimonies when assessing age. So in many cases, minors tend to present themselves as adults in order to avoid the time-consuming child protection system and overstretched also, and in order to continue their journey. Other times, many minors present themselves as accompanied, often appearing or claiming to be under the guardianship of another adult or another family, only to find themselves later unaccompanied in order to continue their journey. The biggest risk of this gap is now that minors find themselves among adults being treated as adults. This failure of the system was revealed fast as the Greek authorities registered 2,248 unaccompanied minors within 2015. However, more than 18,000 minors, unaccompanied minors, were reported crossing the Greek-Fyrom borders, indicating that more than 90% of minors became invisible while traveling. The second biggest risk that forces unaccompanied minors to avoid the child protection system is the detention of unaccompanied minors behind bars inside the detention centers for a prolonged period of time due to the lack of specialized facilities for unaccompanied minors. And how did this happen? Well, during the increased influx, the government realized that it was impossible to provide a safe environment for these minors. So in order to separate them and protect them from the other adult refugees, they decided to put them behind bars. And even though in these detention centers all the basic needs of the minors are ensured, They have legal representation and information about the asylum process. They even have access to educational activities. Still, minors are deprived of their own liberty for a prolonged period of time. And this causes frustration, anger, and violence. I had the chance, as a volunteer in Lesvos, I had the chance to talk to some of these unaccompanied minors, and they told me that they were there for more than 6 or 7 months. And most of them, they don't understand why they are there. They feel that they are criminals, and they have done something, so the detention is their punishment now. Unfortunately, in hotspots like the one in Lesvos, this failure of detention had an impact also on minors with their families, because they have to stay inside the detention center until the asylum process is completed, and they have to share the same living space with hundreds of adult and other adult refugees. And of course, you understand now that they are exposed to violence and also to cases of sexual exploitation, and we will discuss about this in a bit. This prolonged detention of minors is a direct reflection of the reluctance of European authorities to take responsibility for these unaccompanied minors. And failing to protect these minors, the European Commission came up with a plan, the relocation scheme, in September 2015, suggesting the relocation of 160,000 people from Greece and Italy to other European countries within the course of 2 years. However, a year later, only 6,000 people have been relocated. And this table here illustrates exactly this failure of the relocation scheme. The first column shows the number of refugees that each country committed to welcome, while the second and the third column demonstrate the number of people that have been relocated from Greece and Italy. As you can see, many countries decided to welcome refugees, but they never did in the end, while some Central European countries fought the scheme either by refusing to accept any refugees or by committing to welcome, but they never did in the end. Some other countries like Hungary and Slovakia fought this plan to European courts. Unfortunately, from the 6,000 people, only 29 unaccompanied minors have been relocated. This inability of Greece and Europe to initiate promptly child protection procedures has exposed them in a situation of extreme violence, increasing the risk of their sexual exploitation. And this is one of the most severe risks that minors face in Greece. Inside the camps, the frustration and anger the adult refugees face due to the delays of the asylum process and due to the perilous living conditions inside the camps lead to an increase in the frustration and aggressiveness against each other. So many of the adult refugees set fires, they participate in criminal gangs, they engage in criminal activities, and they also physically attack each other. Minors, accompanied and unaccompanied, as we mentioned before, being caught in the middle, now witness this violence, they become victims themselves, or they imitate these violent acts. Unfortunately, in the detention center in Lesvos, we had a case of rape of an unaccompanied minor by other unaccompanied minors. In the camps in mainland Greece, parents talk about, report cases of sexual assault of their children by other refugee adults. And volunteers inside the camps talk about cases of sexual exploitation of minors by the criminal gangs. And these cases were extremely limited before the EU-Turkey agreement due to the mobility of the population. Unfortunately now, after the EU-Turkey agreement, these cases have been increased due to the detention, frustration, and lack of resources. Because of this lack of resources, now unaccompanied minors that became invisible from the child protection system offered sexual services in the heart of Athens in order to gain some money to be able to continue their journey. So for the 27,000 minors, because this is the official number of minors after the official registration of the UNHCR in July 2016, these risk or severe threats to their well-being. However, there is also a positive side, and now I would like to discuss with you some very successful implemented practices in Lesvos and in some other camps in mainland Greece that tried to address successfully some of these risks. The first successful implemented practice was the creation of the second-line facilities, which are pioneer transit camps that host very vulnerable refugees. The first camp is the Karatepe and is run by the municipality of Lesvos and hosts 1,500 refugees, the majority of whom are single mothers with their children. Prefabricated containers have been provided to them that secure privacy and protection. The sanitation facilities are amazing and they even offer access to people with physical disabilities, while NGOs are responsible to deliver 3 meals per day to every single container in an effort to avoid the lines and the chaotic situation that these kind of distributed food causes of distribution of food. Also, there's daily access to psychological and medical care. And in a case of an emergency, there is a private ambulance that drives people to the local hospital with the escort of a member of an NGO that facilitates the dialogue between patients and doctors. And this is one of the main problems that the other people from the detention center face, because we don't have so many translators. And this is a very important problem when you have to provide medical care. However, the most important thing in these facilities is the provision, and they provide access to educational and recreational activities to all the refugee minors inside the camp. And this was the first camp that did this. And this was a very important change because now it shows the change of Lesvos from a transit place to a place that hosts now a long-term resident population. The second camp is Pikva and hosts the very vulnerable cases such as disabled and sick people, pregnant women, families of victims of shipwrecks, and people with the diagnosed psychological disorders. They host 100 approximately people, and they offer daily access to psychological and medical care that is tailored to the needs of each one of these people. Because the number of people in these camps is small, the government and NGOs are able to satisfy their basic needs and their basic rights. They are able to control the environment and also create a sense of community among the guests, and this is how they call the refugees there. The second best practice was the creation of the third line facilities that are located in dedicated community-based shelters, and they provide a safe environment for very, very vulnerable families and unaccompanied minors. These are run by local NGOs under the supervision of UNHCR, and they ensure all their basic needs of the unaccompanied minors. They provide legal representation, information about the asylum process, as well as the risks that the minors may face if they decide to avoid the child protection system. But the most important thing here is that minors are not detained anymore, but they have the chance to socialize by participating in community-based activities. As you can see here, there is a lot of coordination and effort to create more third-line facilities because unfortunately, right now, only 1,110 unaccompanied minors have found a spot in these facilities. And we still have 1,600 minors waiting for a spot there. Lastly, another good and promising practice is the very recent launch of the educational plan run by the Ministry of Education. As Greece now changes from a transit place to a long-term place that hosts refugees, the education of minors, that the majority of whom are out of school for more than 2 years, is extremely crucial. This is quite a difficult practice, as given the large number of minors that should be integrated, the different age groups, and also the lack of knowledge of the Greek language. So the Ministry of Education had to suggest different ways of integration. We are not able to evaluate this plan yet, as it is very new. Barriers and difficulties do exist, but it looks very promising. For a month now, hundreds of refugee minors attend school either in the community or inside camps in an effort to integrate as soon as possible 22,000 minors. Even though our research focused specifically on Lesvos, unfortunately the situation in the rest of the camps in mainland Greece is even worse. Minors face a series of challenges and risks, while their desire to continue their journey expose them to the smuggling and trafficking industry that continues to thrive. Greece has received a lot of criticism for the way it handles the crisis, for its inability to ensure their basic needs and guarantee the basic human rights of refugees. However, we need to understand here that Greece is one of the least financially capable countries to face such a crisis of such a magnitude. And also, we have to remember here that Greece is in the middle of the worst economic crisis of its modern history. For 2 years now, the inability of Greece and Europe to face this crisis and help the people was balanced by the solidarity of Greek people that, in an individualistic way and despite their financial problems, opened their houses and shared their own food with the refugees. However, these positive attitudes have started to change, turning into xenophobia and racism, exactly because the existing refugee population increases, the financial problems of the Greek people also increase, and effective solutions are not provided. Greece should take measures to improve the living conditions, but such a magnitude of a humanitarian crisis requires a global response. Individual countries have done little by way of resettlement, leaving the burden of this humanitarian crisis to a small number of countries. Only a global response can ensure the well-being and care of these very vulnerable children on the move. Thank you very much.
Why don't we take a couple of questions now, and then we'll have Alexander come up. So does anybody...
Do you have an update about the deal between Turkey and the EU? Any changes? Or?
So this is a very good question. When the deal was signed, they suggested that all the arrivals after the 18th of March 2016 should be deported back to Turkey, and then Turkey would be responsible to see if the people were eligible for asylum or not. But this created a lot of problems among NGOs because they said that Turkey was not the proper country to host these people until the asylum process is completed. And also, it would not be good to deport back people who seek for asylum. So what happened is that from the moment that people arrive to Greece, if they apply for asylum, they stay in Greece. If they don't apply for asylum, or if their asylum is rejected, then they're going to be deported back to Turkey, and then from Turkey they're going to be deported back to their countries. So what is happening now is that the EU-Turkey agreement doesn't really work in the way that it should work at the beginning, because people come, they apply for asylum, and the asylum process lasts for about a year. So for a year, all the new arrivals are staying in Greece. We had the first deportation in April, and I think that a month ago, another 60 people were deported. Some of them were not eligible for asylum, and some others didn't apply for asylum. But the deal is not active anymore. Of course, we have to detain people because they arrive to Lesvos, so they have to be detained, but they are not deported until the asylum process is completed.
How do you think it's a percentage of people who are real refugees fleeing war or political persecution, or young people just thinking that they will find something in Europe that doesn't exist and are victim of this organized trafficking of
So at the beginning of the crisis, the majority of people were from Syria. Right now, we have more Afghanis, Pakistanis, Somalians, and people from Ethiopia, and Iraqis also. So again, this question has to do with the decision of who is a refugee. Because at the beginning, Afghani people were also considered as refugees, but now I think that Afghanistan is considered as a safe place, so people can go back, so they don't give asylum to Afghani people. So right now in Greece, in Lesvos, I will talk about Lesvos, we have more people from Afghanistan and Pakistan. than Syria. So I'm not able to talk about percentages, but for sure the Syrian refugees crossed at the beginning of 2015. Now we have people who try to move for different reasons. But again, you can say that Somalians are not eligible for Eritreans, excuse me, not Somalians. Eritreans are not eligible for asylum. They have war, so these people are also eligible for asylum. But right now we give to Syrians and Iraqis asylum.
Couple questions. The first is who is administering or making this determination about who is in asylum or who is it UN? Is it in-country officials? And then also what proportion of the youth that you're talking about are unaccompanied, and around what ages are they?
Yeah. So it's not a decision of one country only. There is a cooperation with the European Union. So now we have we have Frontex agents, and we have also the asylum services in Greece, in the hotspots in the islands of the Aegean Sea. So they decide who is responsible, who is eligible for asylum or not. It's not just the decision of Greece. Also, regarding the percentages, we are not able to say for sure because they become invisible. So we don't know. And this is one of the main gaps because, of course, you identified 2,000 unaccompanied minors and you believe that, okay, this is the number that we have. But when they try to leave and then they cross another country and they want to have the child protection system to protect them and they reveal their own age. So we're not able to talk with numbers here. We don't know how many children are invisible right now. And I met when I am from the island of Lesvos, so I witnessed the whole crisis from the very beginning, and I spent many hours at the shores helping people coming out of the boats, and I met many children who tried to convince me that they were more than 18 years old. And it was clear that they were 12 or 15. And they believed their story. They want to convince everyone that they were more than 18 years old because they wanted to continue. And because many of them had given a promise to their parents that they're going to reach the final destination as soon as possible so they can bring their parents to the final destination. So any kind of delay during the migration journey is a problem for them. So they try to avoid it. And again, we're not able to talk about percentages.
As for the replaced unaccompanied minors, you said that it's a very small number, but at least in terms of the process, are they given to foster families or to institutions? How does it work?
So there is an effort to find the legal guardianships for the unaccompanied minors, but the process in Greece is at the very, very beginning. So right now, the legal guardianship is the public prosecutor for minors, and he has the responsibility for the unaccompanied minors, while some NGOs, like the third line facilities that we discussed, are responsible to secure their basic needs. But again, the very important decisions for these minors should be taken by the public prosecutor for minors. So again, we could have families that could take responsibility for these minors, but the system is very, very at the very beginning. And this is something that we try to improve.
Maybe one last question.
Yeah.
You were saying that there's a tendency in some of the newer camps to provide services for the long term, sort of not just as an emergency detention facility. Do you see that trend continuing or changing?
So there was a very good practice that started in Greece with the second line facilities, and we have also these practices in some other countries in mainland Greece. Unfortunately, in order to do this, you need money. And Greece, being in the worst financial crisis right now, is not able to spend a lot of money. We are waiting for money from the European Union, and as I checked today, they promised to give us 300 million in 2016, but they allocated only 1.3 million. So you understand that in order to have these successful practices, you need money. And because you don't have money, you're not able to do this. And what you have, some tents in a place just to provide some safety. Hopefully we will have more second line and third line facilities, but we need resources.